And that's what happens when you have people running the country that are dumb. Sorry. That's the song I sing to myself frequently. Hello, team, and welcome to Bureaucracy. I'm your host, Emily Gross. I'm joined today by Joan Alker, who's the Executive Director of the Center for Children and Families at Georgetown University. We're going to be talking all about potential cuts to Medicaid and CHIP and the social services that are on the table as the GOP tries to pass through this big budget bill. Joan, thank you so much for being here.
Thanks, Emily, for having me.
All right, before we dive in, what are we drinking?
I am drinking Pellegrino with a little squirt of lemon on the rocks.
Ooh, spicy. Okay, so I'm gone a little bit more hardcore. Generally, I have a beer. However, I thought I had beer in my house. I didn't. So I made myself a version of a lemon drop, and I'm going on a date after this. So I'm treating this as my pregame, and this is going to be good. So cheers.
It's possibly a good day for that.
Exactly. You know, it's with everything going on, sometimes it just needs something a little harder. But Joan, before we begin, the question I always love to ask is, why should we trust what you have to say?
Okay, well, fair question, especially when you're talking about healthcare, because we have so many economic interests in our healthcare system. So I will say that I have been working on Medicaid policy for about 25 years now. And at the Center for Children and Families, we are all externally funded for our work, and we have very strict policies about our money. We actually do not accept government funding at all. Oh, wow. Which is helpful right now.
Yeah, no, glad to hear you guys are still cranking out the stuff. Yeah.
And we don't accept any money from corporate interests in the healthcare system. So cool. Our mission is to ensure that we have better public policy for children and families in this country. So all of our work is funded by foundations, basically. And so we try to be really just approaching the work from that perspective, like what's going to make government work better for families.
Yeah. So I think you guys probably have some of the cleanest money out there. So, which is good. Definitely makes you more trustworthy in my opinion. All right. So what a time. So the GOP that it just passed through the House, it's now going to the Senate. But this big and beautiful bill, which if you don't roll your eyes at the name, you're much better suited than I am. But this bill basically is, I mean, you probably can do a better explanation of it, but it's this huge budget and tax bill that's going to implement all these tax cuts. And the way they're trying to compensate for all the lost revenue through these tax cuts and this extra spending that they're doing for things they deem important, like border and defense spending, is by cutting social services. What's in this bill and why should people be concerned?
Yeah, so this is, as you said, this is the big bill. This is the bill to implement President Trump's agenda and really to give a lot of tax cuts that will disproportionately benefit richer people and fund his other agenda, like his immigration agenda, paying for more money for ICE, for example, more money for defense. And the bill is actually not fully paid for. It's going to add to the deficit. But to the extent that they are making offsetting cuts, one of the biggest targets in the bill is Medicaid, which we're going to talk about, and also the SNAP program, which provides nutrition assistance. Those are some of the biggest cuts. And that's one reason why this bill is so skewed towards helping richer people, because lower income people, Medicaid and SNAP is a really important part of their economic security.
So I just did a video on this for my personal Instagram because everyone needs to be aware about what's going on. But so 72 million people are on Medicaid. And I think some lowball estimates were saying that if these new requirements were to go into place, it would kick off, I think, around 7 like lowball estimates over around 7 million people. What are some of the requirements that this bill would implement, and what is the ultimate effect of that?
Yeah, so Medicaid is really important. I always call it sort of the backbone of our healthcare system. It's doing a lot of things that people are probably not aware of, really throughout the life spectrum. So, for example, it's paying for 40% of births in the country. And in rural areas, as we may want to talk about, it's actually more important for rural areas, it's paying for 47% of births. It is paying for health insurance for almost half of the children in the United States. It's covering a lot of low-income parents and other adults and people with disabilities. And at the other end of life, Medicaid actually helps make Medicare work. Medicare, of course, is primary health insurance for seniors, but Medicare doesn't cover long-term care. So Medicaid picks up a very important and expensive service, which is long-term care. Both the majority of seniors in nursing homes are covered by Medicaid, home and community-based care. So as you can see, Medicaid is doing many, many things. Now, this bill is a big bill, complicated bill. You know, when the language came out, which I'll just note for the record, came out 10:30 p.m. on Mother's Day.
Ironic. And they worked through passing it at 1 o'clock in the morning because, all good things happen in the cover of darkness.
Absolutely. I am a night owl, but I am tired. So we've had many, many very long nights.
Yeah.
And a lot of the provisions were so complicated that Congressional Budget Office, which is kind of the nonpartisan scorekeeper, didn't even get a chance to assess their effects. But what they do say is that this bill will cut about $800 billion with a B dollars out of Medicaid, and that more than 8 million people will lose their Medicaid coverage.
Wow. So the new numbers are much higher.
They've gone up as they rescored the bill. They did go up.
So I was reading this really interesting article because I think Medicaid is one of these things that if a lot of people don't actually know that they're on it or that's the health insurance plan that they're being offered. How does it actually work? Like, do you pay into it like you would like normal health insurance? Is it lower rates? I know the Affordable Care Act expanded a bunch of the expanded it a lot so that more people could get on it. What it's like the actual ins and outs of how Medicaid works.
So Medicaid, again, if you think about Medicare is a lot simpler because Medicare is run by the federal government. And like everybody knows, when you turn 65, you're eligible for Medicare. And you can go to Medicare.gov. They have a 1-800 number for you to call. So it's pretty simple. But Medicaid is already a lot more complicated because it's run by states. So every state has a somewhat different Medicaid program, and it might have a different name, right? So in California, it's called Medi-Cal. In Wisconsin, it's called Badger Care, right? So that's part of the reason that it's confusing. And then, but in a lot of cases, in most places, once people get enrolled, which can be a complicated process depending on how hard the state wants to make it for you, most people are getting a private insurance like a managed care plan. Now, the majority of folks who are covered by Medicaid are on there because their income is low, right? So their children actually have higher eligibility to 2.5 times the poverty level. So that's why we have so many children covered. More generous rules for children.
For adults, it's 138% of the federal poverty level, by the way.
That's right. You're right. Except if you're pregnant, there's higher limits. But yeah, generally speaking. So because it's really for low-income families, by and large, there are no premiums in Medicaid. And for kids and pregnant women, there are no copays either because we know that's a barrier to care for really low-income people. So that's actually one of the things the bill does is it raises the co-payments for some adults.
Oh, wow. Okay. Interesting. And so what else does this bill do? Because I know a big part of it is work requirements. Are there work requirements already? Are there not?
Yeah. So this is kind of the marquee issue. So when the Affordable Care Act passed in 2010, it did, and I'll have to indulge me here in a little bit of history, but the goal was to move our country to a country where everybody had a path to health insurance. And like I always say, health insurance is the price of admission to our healthcare system. And if you don't have the price of admission, you're not going to see a good show, right? So it had taken 100 years and to get to a place where we actually got to something approximating universal coverage when President Obama, made this his top priority. But subsequent to that, the Supreme Court knocked down one of the key legs of the stool, which was that states would have to expand their Medicaid program for adults to the adults you just mentioned, under 130% of poverty. But essentially, they made that a choice for states. And so it's been, half or more of the states immediately took up the choice. The federal government was paying most of the cost. But to this day, there's still 10 states, they're mostly in the South, and they still haven't done it. So there's been a lot of political fighting about this. It's called the Medicaid expansion. At this point, red states that haven't done it and purple states, it's been a battle kind of state by state. And interestingly, it's not a battle at all as far as the voters are concerned. When it has gone to the ballot in every red state, it has passed. But the same proponents of cutting Medicaid today have been fighting this state by state. So if they can't beat it entirely, they try to whittle it back by doing things like work requirements, adding more red tape. That's what we see a lot of that in this bill.
Got it. And so states can decide whether or not to add work requirements, but the federal government doesn't currently have work requirements?
No, there's no work requirements in Medicaid. There will be if this bill passes and is signed into law. We've had a couple of states try them because there are ways you can try things out in Medicaid. But a few things happened. First of all, the courts struck down those attempts to try work requirements because it doesn't meet with the objectives of Medicaid. The objective of Medicaid is to give health insurance to low-income people, but in fact, imposing work requirements does the opposite. It takes away health insurance from low-income people. And it was tried in Arkansas, and we have one in existence right now in Georgia. And I'll tell you the kind of simple answer is that work requirements don't work. I can understand and be sympathetic to government may want to support employment as a policy objective, but this isn't the way to do that. If you want to support employment, you got to address people's barriers to employment, right? Childcare, transportation, the lack of jobs, job training, whatever it is. But actually providing health insurance helps people work because then they can address their chronic conditions. So what we saw in Arkansas is that it had no impact whatsoever on employment, but it did mean a lot of people started losing their health insurance because what happens is there's a lot of red tape people have to jump through. There's supposedly these exemptions for all these things, but it's very complicated. The government doesn't do a good job of explaining the rules or making the systems work. So unfortunately, a lot of eligible people, in fact, millions, are going to lose coverage because of this provision.
I think a study came out recently that showed that the states that implemented the Affordable Care Act expansion saved over 20,000 lives. It was some crazy number like that because the amount of people that were able to then get health insurance and be proactive in their health. I think from 2010 to 2022 or something, I believe the number was 20 or 27,000. A significant portion of lives were saved just because of access to Medicaid.
I think I know what study you're talking about. It was about a 21% reduction in mortality because of Medicaid expansion. And truly, there are hundreds of studies about the value of Medicaid expansion. But unfortunately, that's not what Congress is making policy on.
No. Why would they do that? Science? Crazy. Crazy concept. So my next question, I guess, comes down to SNAP and CHIP. These are the big three that people are discussing right now. And it's still so unclear to, I think, a lot of the population as to what they provide, how low income you actually have to be to receive it, and the little that is provided. So which one do you want to start with, SNAP or CHIP first?
Well, I know a lot more about CHIP, so I
Let's
will
talk about
start
CHIP.
there.
Cool. Perfect.
Yeah. So CHIP stands for the Children's Health Insurance Program. And as I always say, CHIP kind of sits on the shoulders of Medicaid. It works with Medicaid. Medicaid is by far the bigger, more important program for children. But CHIP has played a really important role in really moving us as a country towards pretty low child uninsured rates, which unfortunately have been stagnating and are going to go backwards, I think now. But
what's the current level?
We got down to about 5% uninsured children, 4% uninsured children after the ACA passed and was implemented. But in the Trump administration, first one, it bumped back up a little. So it's been kind of bumping around, but the lowest we've ever gotten it down to is about 4%.
And what do you think if what's currently being discussed is passed? What do you think it would bump it up to?
That is hard to say because there aren't direct cuts in eligibility to children, but there are cuts to their parents, which tends to knock children off. The other factor here is that, as anyone can see, we have an extremely hostile climate to immigrant families. And a lot of children are in what's called mixed status families. So they're citizens, but their parents might be immigrants. And they're rightfully terrified of interacting with the government right now. So we would expect to see children just losing coverage because they're eligible, but their parents are too scared to sign them up. So there's a lot of factors here, and certainly the bill is going to create other problems too. But to kind of get back to CHIP, CHIP has been, like I say, a key piece of the puzzle. A lot of states, it actually is Medicaid. It's the same thing. But in the bill that's pending right now, they're rolling back some regulations that actually were going to go into effect that were going to modernize CHIP and protect children from periods of uninsurance. So this is
crazy, terrible idea.
It's very, very frustrating to me as somebody who's been working on this for many years.
Protecting children and modernizing things? Horrendous. How dare they?
Yeah, it's really, it's very aggravating to say the least. But there's a few states, not a ton, but 10 to 15 states that have some really outdated policies that force children to have waiting periods before they get CHIP. These date back to literally the last century, and we're trying to get rid of them. But unfortunately, this bill rolls that back.
Awesome. So do kids have to be under a certain, their families have to be under a certain poverty level as well? Is it also 138 or is it higher?
And no, it's higher for children. The average, it differs by state, as we've talked about, because states can make choices. So the highest state would be at 3 times the poverty level. Kind of the average state is about 250% of the poverty level. So that's the main way that children get covered by Medicaid and CHIP. But it's also children can get covered if they have a serious health condition or a disability. And that's another really important piece of the puzzle because, Medicaid, again, we talked about how it makes Medicare work. It also makes private insurance work for some families because the benefit package is just not good enough. If you have a child with a really serious condition like cerebral palsy or something really serious where they need a lot of care, the private insurance doesn't cover that. So Medicaid will wrap around that. And so children with severe disabilities are also covered by Medicaid.
So let's talk about SNAP.
Yeah.
And what's going on there?
Yeah. So again, I'm not the world's expert, but I can tell you a few things. So SNAP is nutrition assistance for low income people and families. And the bill it makes a lot of cuts to SNAP as well, in terms of both making changes, making a less generous benefit. They have a work requirement already in SNAP, but they're making it a harder work requirement, applying it to more people. And then a really important thing is that for the first time ever in the history of SNAP, the House bill says to states, you've got to pay for some of this now. So this is a really important point because, one of the kind of neat tricks here for Congress is that governors run Medicaid. So when you cut Medicaid at the federal level, you are essentially handing this to governors and say, you do the dirty work. You're the one that has to make the cuts and the bad choices.
Caveat to that is this bill also includes something saying that states can't raise more taxes or change any of the ways that they would raise funds by charging people more in order to offset the cuts from the federal government.
That exact concept is also in the Medicaid cuts, because there are some cuts. We talked about the work requirement. That's a big limitation, but they are also restricting the way that states can raise their own revenues, an issue we would not want to get into without a lot of heavy drinking, called provider taxes, because it's really boring and complicated. But the point is exactly what you're saying. They are giving governors, they're going to hand big cuts to them. They're limiting the way that they can make up for those cuts by restricting the way they can raise revenue. And so governors are going to have very bad choices. They can raise taxes a lot, although they're limiting their choices there. They can cut Medicaid benefits, reimbursement rates for providers, or they can cut other things in the state budget, like K through 12 education or roads or law enforcement, right? So states, and now they're going to have to pay for SNAP too, right? So you have to look at this bill in totality in terms of what they're handing to the governors, who, by the way, have to balance their budgets every year in a way the federal government doesn't.
Okay. For SNAP, currently adults ages 18 to 54 without dependent children can only receive food stamps for 3 months over a 36-month period unless they work 20 hours a week or are eligible for an exemption. This would extend the requirement to 64 in parents of children between the ages of 7 and 18, which is huge and really messes up with parents. It could put 11 million people at risk of losing their SNAP benefits. America's a great nation. We only want people to go hungry and without health care. It's fine.
Well, the irony here is, of course, the president really ran on addressing people's cost issues, right? And this bill is doing the opposite, potentially raising healthcare costs for folks who either lose their coverage or have to pay more with the increased co-payments, and also may see reduction in their SNAP benefits. So their food costs will go up.
Hypocrisy is, I think, a frequent player in the Trump administration. And don't forget, the reason why this is all happening is to pay for tax cuts that's going to benefit rich people. So, I mean, is there anything else? So the one caveat I'll say is that we're recording this. It's just past the House. It has to make its way to the Senate. One surprising Senator Josh Hawley, who's Republican from Missouri, even wrote, I believe, a New York Times article, or as Wall Street Journal. It was some big publication article basically saying the Republican Party is dumb and it goes against our voters' interests. It goes against our political party's interests if we make cuts to Medicaid. So big hoping that the Senate is going to push back on a lot of this. And hopefully some of the really extensive changes that would have such detrimental effects will be peeled back a little bit in a little bit more of a mild manner. I would be pretty shocked if this is not passed in some way and that there isn't some drastic effects, but hopefully it will be a little bit more mild than what we're seeing at the moment. Hopefully.
Yeah, well, we'll have to wait and see. I mean, as you said, Senator Hawley from Missouri has been fairly outspoken. We know that there are other senators who have concerns. By the way, we didn't touch on this. The bill in the House wipes out all federal funding in Medicaid for Planned Parenthood, which has, Medicaid does not pay for abortion. And so it's not even about that. It's about, Planned Parenthood is a really important provider for women of other health services and reproductive health services. But the bill, wipes out all their Medicaid funding. So that's a huge blow. So, maybe some like Senators Murkowski and Collins have concerns about that in the Senate. We don't know. I mean, I think they do, but what they do about them, I don't know. Um, so there may be, and what's been really interesting in watching this, and like I said, I've been working on Medicaid for a long time. The voters really don't want this, and the president's own pollster said, did a poll and was like, no voters want you to cut Medicaid, Republican, Democratic, or Independent. And even Steve Bannon said a lot of MAGAs rely on Medicaid. So there's a lot of dissension inside the Republican Party. It's really interesting. The kind of new, more populist wing has, some strong feelings about this, but then we want to cut the deficit. We want to cut spending. We don't want to spend money on poor people and they're nasty and not worthy. You're seeing a lot of that debate play out. So I don't know where we're going to end up. I think, there's something's going to pass, right? There's a lot of momentum behind this. Something's most likely going to pass, but, hopefully some of these damaging Medicaid cuts will be mitigated.
Hopefully. It's designed for people that are low income, and a lot of people that are low income are rural folks, which happen to be a really strong voting bloc for Republicans. So it's just like, it goes against any interest unless you're rich. Then you don't really care, right? And unfortunately, as we saw when Trump was inaugurated, some of the richest people in the entire world are on the stage, right? That's what's on the mind for this administration. And a lot of also just want to hear your thought on this, because a lot of people say there's a lot of fraud. And we had someone talk about SNAP fraud on the podcast, and that was really interesting, being like, there's not really people trying to take advantage of the benefits. There's people defrauding people who receive benefits and taking away their benefits. But is there a lot of fraud that goes on in Medicaid and CHIP?
Yeah, so here's a hot tip. If you're looking for fraud in Medicaid, people who are enrolled in Medicaid, who are being covered by Medicaid, are the victims and not the perpetrators. So it's your little guide to cuts that they're making. If they are cuts that are directed at people, like, for example, the work requirement, which is just going to kick a lot of people off, millions of people, that's not addressing fraud. Here's what fraud looks like. Like, every health care system has fraud. We don't know how much fraud Medicaid has. But obviously you have unscrupulous criminal actors who maybe have fake labs charging for services or overbilling, unscrupulous providers. Maybe we have some, hackers somewhere, whatever. But people don't get money from Medicaid. They get health care. And so that's, if you wanted to address fraud, which everybody does, then you would see proposals in this bill to do things like hire more prosecutors at the Department of Justice to go after criminal actors, beef up state fraud control units to go after fraud. But that's not what's in this bill. There's a few things that reasonably address fraud, but that's a nothing burger in terms of the $800 billion they're cutting. And that's, like I say, that's my hot tip is look at the proposals. Are they resulting in people losing Medicaid? Then that is really not about fraud. That's about saying, we don't think you should have Medicaid.
Correct me if I'm wrong, but the whole also argument about people who are here that are undocumented, and I hate the term illegally because I think everyone should be legal to exist, right? But here illegally, right? They're not allowed to, they don't receive any federal Medicaid funds. It's a state choice.
Yeah,
They only
so
receive state funds?
this is just a huge topic of misinformation. You will be shocked, I'm sure, to hear. So undocumented people are not eligible for Medicaid coverage with federal funding, period, end of story. They're not eligible. Some states choose with their own taxpayer dollars to fund coverage for, frankly, most of these states are just covering undocumented children. A few cover adults, like California, probably being the most famous, and Illinois. But that is not with federal funding. So that has nothing to do with federal Medicaid funding increasing, which is what people were saying constantly in this committee process we just went through in the House, that that's driving up Medicaid costs. No, it's just not true, because they're not eligible for federally funded Medicaid, period, end of story. Now, there is one exception to that, and that is something called emergency Medicaid. And we have emergency Medicaid because hospitals cannot turn away people in the emergency room in this country, right? So if you had a woman who was giving birth, she's not going to give birth on the sidewalk. She's going to be in the hospital. If you had someone having a heart attack, right? So emergency Medicaid is because of this EMTALA law that we have, where hospitals can't turn people away. And it's some reimbursement for those emergency situations. It's not coverage. Sometimes it's 1 day in the hospital. That is less than 0.5% of federal Medicaid's funding. And ironically, despite all this rhetoric, the bill doesn't touch emergency Medicaid, which is the only thing the federal government does spend money on undocumented people.
And that's what happens when you have people running the country that are dumb. Sorry. That's the song I sing to myself frequently.
And I wouldn't say that. I would say it's scapegoating.
Yeah, absolutely. Complete scapegoating. It is, they're just trying to find any reason that they can basically misinform their supporters into supporting less Medicaid, right? And that's what they're doing. It's pure BS. This bill would also take away more money from states if they offer services to undocumented children, correct?
Yes, there's a penalty. So
yeah.
if states cover undocumented people or children in Medicaid or CHIP, and I'll just say like Utah is actually one of these states that covers undocumented children in CHIP, they lose 10% of their federal funding for their Medicaid Affordable Care Act expansion adult group that we talked about earlier. So pretty much this is going to force these states to drop their state-funded coverage.
Yeah, and what happened to the argument that states should decide?
Right. That's another really incredible, I guess we'll call it an evolution here, that federalism, right, which was always a big tenet, particularly for Republicans, is really nowhere to be seen in this bill. You have this work requirement mandated on every state in the country, even ones that don't want to do it. And, you have these restrictions on how states can spend their own money.
Quite ironic. Well, Joan, any last things you'd like to touch on?
I think we got to a lot of it.
We did good. We did good. Well, it's been a pleasure having you on. Once again, wish it was a better topic. But it's so important that people are informed and fight against all this misinformation that's spewing everywhere. So thank you for doing this. I appreciate it.
Yeah, thanks, Emily, for your interest.
Yeah. And I'm your host, Emily Gross. We'll be back next week with another episode of Bureaucracy.